It's interesting. Men can have prostate issues, which mean difficulty urinating, urgency, frequency, and that doesn't necessarily mean cancer. The diagnosis of cancer is oftentimes done by the elevation of a PSA. Also not a great test because a PSA can be elevated for simple infections and for benign prostate enlargement. In my case, the PSA, and it's not about the number necessarily, it's velocity of change over time. So that if your PSA was 1 today and next year it's 3, that's a large change. And in my case, there was an increase in velocity. I got concerned. I initially did have blind biopsies, which retrospectively was not anything I would ever do again or recommend. I eventually did find Dr. Sperling because of my research in the use of the MRI. It's interesting because you would think that this technology would be embraced by every single large institution in this country. They just don't. When I was first had suspicion, well, no, I had a biopsy, so I knew that there was cancer. And but I did my research and did find Dr. Sperling. And my initial contact with Dr. Sperling was in New York when his clinic was in New York, and I went there, and like everybody else, pretty apprehensive about, is this going to end my life? Is this going to end my sex, my interest, my ability to have sex? These are all really major concerns. The interesting thing was, even when the clinic was in New York, the staff he had, many of whom are still with him, was wonderful, just to allay anxiety and to really make me feel like, all right, calm down, everything was going to be okay. Initially, all I came in for was the biopsy. The biopsy then got sent to a lab, and that takes a week or 10 days. And then after that, if there is cancer found, then you're rescheduled to come back in. In the same way, in the MRI, with absolute discrete entry into the cancer cells by itself, and then the ablation of those without damaging the surrounding tissue. So I was pleased with not only my initial experience of the biopsy, but then after that, it was easy for me to make a decision to come in and get the laser treatment afterwards. I did my homework. I interviewed a number of different physicians. I looked at a number of different options. And even since then, since 2014 when I was treated, and this is now 2022, there's a bunch of new things that have come up, new treatments, new procedures, new protocols, all of which I stay current with because I manage men with prostate cancer after they've had their treatment. So I need to know what's out there. In my research, I haven't found anything that I think is remotely as good as, has the best outcomes with the least amount of side effects as the MRI-guided laser ablation treatment. Let me say this about this treatment modality as compared to, say, having your entire gland removed, which is an option to some people. I still have a prostate, and every so often I come in for my evaluation and get looked at again. So the one thing about this type of treatment is, yes, the chances of ruining a sex life or having urinary tract issues is quite low, but you still have a prostate and it still requires evaluation. So it's a relationship. And patients who come to this clinic build a relationship not only with Dr. Sperling, but his wonderful staff to make sure that there are timely reviews and visits because the prostate is still there. When a man gets a diagnosis of prostate cancer, it's almost like a death sentence initially. It is really devastating because it's all about maleness, really. Being able to be okay with surveillance it's really important that you stay with your primary care doctor and you get your PSAs and you have that discussion. If you're having changes in urine or urine flow, those are discussions that you have to have. This is something that you need to watch, because the quicker you make a diagnosis of prostate cancer, the more likely you're going to get the more likely that the treatment will be easier, less side effects, and more effective. So the Sperling Clinic actually is a private clinic. And unlike a hospital milieu, you're treated in a very sort of nurturing, wonderful, warm kind of way, as opposed walking to a hospital with all the calamity that's there and all the hassle, and there's sick people, and there's hospitals are very unpleasant. I spent a good portion of my life dressed up in paper gowns and in surgical rooms. Nobody likes to be there. The ability to have this disease treated in this kind of wonderful outpatient, caring, warm manner really makes a really big difference. And I think that's an important feature of why this practice is so successful.